This is pushing a personal, either attendings or a program or ACGME, their politics onto a particular individual, which is absolutely wrong. Again, going back to what happened during the pandemic, healthcare became political, and the powers to be overtook it with what I just believe is liberal progressivism, and they have decided that their opinions, their political beliefs are what everybody should do, and it's coercion, it's abuse of authority. Again, I'll say this multiple times, we're not litigating the legality of abortion. We are
Right.
litigating, trying to say you cannot be forced to do one, especially an authoritarian hierarchy that residency is.
Welcome to Caring for Both, a curbside consult series by the American Association of Pro-Life Obstetricians and Gynecologists, or AAPLOG. On this podcast, we bring on experts to provide insights to support you as a medical professional in your life-affirming practice and career. I'm your host for today, Dr. Susan Bane. I'm the board chair for AAPLOG Action and the vice chair for AAPLOG. Today, we're discussing an exciting and important new bill for medical residents nationwide who want their conscience rights honored. Many AAPLOG members have seen firsthand the harmful impact of opt-out abortion training. This policy places undue pressure on medical residents, forcing them oftentimes to choose between their conscience, their convictions, and their careers. No resident should have to jeopardize their future simply to decline training that violates their commitment to life-affirming medicine. And let me be clear, every OBGYN resident already learns how to manage miscarriages, ectopics, and other pregnancy-related complications as part of standard medical residency training. In a time when maternal health care deserts are growing all across this country, we can't afford to discourage future physicians from entering this field, a field so many of us love and that is crucial to improving the health of our nation. Thankfully, Representative Greg Murphy of North Carolina, a physician himself, and Senator James Lankford of Oklahoma share our concerns. Dr. Murphy and I were colleagues together when I practiced in Greenville. He's a urologist, and of course, I'm an OBGYN physician. He saved me a few times in the OR. So on Thursday, November 20th, Representative Murphy and Senator Lankford introduced the Conscience Protections for Medical Residents Act. Inspired by AAPLOG and our work with the Pro-Life Doctors Caucus, which Representative Murphy co-chairs, this bill restores true choice by making abortion training opt-in again, as it was for decades and was when I was training. If enacted, this law would require the Accreditation Council for Graduate Medical Education, ACGME, to return to its longstanding policy, abortion training as opt-in only. Representative Murphy joins us to discuss the Conscious Protection for Medical Residents Act. So Representative Murphy, thank you for being here today.
Thank you, Susan. Appreciate you inviting me.
Yeah. So our audience can get to know you a little better. You know, we all had to write that personal statement for med school. Why did you want to be a doctor? What's your background?
You get asked that a lot. I know you do, Susan. I think it's the best career of all the careers they are. We get to care for people. We get to use our mind, use our talents. By far, it's the greatest profession, I think, in the world, being able to touch lives individually. I look back on the 35 plus years of my career, and I'm so glad I made the choice. If I had to do it all over again, absolutely would pick the same path.
Me too. Absolutely. So I was privileged a few years ago to meet some of your fellow colleagues in the House of Representatives who make up the Doctors Caucus. So tell me, how do you go from being a doctor, which you currently are, board certified and still are, but now you're in the House also? How did that happen?
Yeah, this is one of those things, honestly, when you make decisions about your future life, God kind of chuckles and says, hey, watch this. It's always been that my wife and I are always been open up to opportunities that have been put in front of us. Our member of Congress, who I knew as a patient, sadly enough passed away. It opened up a place to run for Congress. My wife and I sat down, prayed about it a lot, and decided that we'd put our name forward and see what happened. And bam, I ended up here in September of 19 as a member of Congress.
And thank you for representing a district that I lived in at one time. And actually, I think with all the changes that can happen, maybe my district again.
Yeah,
So
yeah.
appreciate it. All right, so let's talk specifically about opting in versus opting out. And I mentioned that I trained in the 1990s. I trained 97 to 2001, and it was an opt-in environment, meaning if I wanted to learn to do induced abortions, I could. It is now opt-out. What's your thought as you were considering this bill between the difference in those two?
Yeah, Susan, residency is a hierarchical program. You start out as an intern, and you're moving up and up, and you're always under the guidance or authority of somebody else, either older than you, more experienced than you, or an attending. And so there is a system there that if you don't do what's right in their eyes, there are punitive measures taken against you. Here we have a very, very emotional issue about abortion. Now, this is not litigating whether abortion is legal or not. The Supreme Court handed that down to the states. The states have taken care about this. But what has happened is you have folks who have decided they have the power in ACGME and or other places where they have to force their political opinions upon medical residents, OBGYN residents. That's absolutely wrong. It's an abuse of authority. And they've taken a position that you have to opt out of performing an abortion rather than, as you point out, years long of saying, no, you won't have to opt in. If you opt out, sadly enough, in the authoritarian system that I just talked about, there oftentimes can be punitive measures, you being given a different route. And so it puts people in a bad position, as you've pointed out, to go against their conscience. There's no reason we can't go back to the former way that it was, rather than pushing politics into medicine, which we have seen recently, which I abhor. Medicine should not have politics involved with this. So we need to get back to the system to take politics out. If people want to do it, again, it's legal in certain states. We're not litigating the legality. We're talking about an authoritarian system, and we're talking about the abuse of authority. People should not be subjected to go against their conscience.
So this bill, to make it clear, would still allow those who are interested in learning to do abortions to do them as part of their training.
Sure. We're not taking that away. We're not taking that away at all. But if residency programs force people to do it against their conscience, there have to be ramifications. And that's what we're putting forth. We'll remove GME funding from them. You can't convince some of these people to do things otherwise unless you tie it to money, and that's what we're going to do.
So one of the things that is near and dear to our heart at AAPLOG as a medical organization is the next generation of healthcare professionals, of doctors, and the team of other allied health members. And we've had both medical students and residents share with us how difficult it is to opt out. I know for myself, I had a situation where we were rounding one day during my residency, and I was told to go to OR, let's say room 25, and assist on a D&C. And I got in the room, and the attending asked me to hold the transducer. And when I did the ultrasound, there was a live baby in there. And so I asked her, I said, what's the indication for this abortion? And she said the patient has fibroids. And we won't get into that, but that's not a contraindication to be pregnant. But I said to her, I'm just really not comfortable participating in an intervention where a surgery where one of my patients is going to lose her life or his life.
Yeah.
And she respected it. And I told my team, and it was hard. I had to be brave, but I was in an opt-in environment where the expectation was not that I would do it. Whereas we're hearing from students that their grades are impacted, that they may we've had residents tell us they had to create their own kind of curriculum because they weren't willing to go to a family planning place to do abortions. And so it's a real coercive environment, and especially in a time when we know maternal mortality is too high in our country, and we have counties all across the country that we don't have enough OBGYNs. We hate to think that medical students are not choosing the profession of OBGYN because they're actually being told that if you're not willing to do induced abortions, then you should not be an OBGYN doctor.
Well, Susan, that's wrong. And you used the word of coercion, and that's where this is. This is pushing a personal, either attendings or a program or ACGME, their politics onto a particular individual, which is absolutely wrong. Again, going back to what happened during the pandemic, healthcare became political, and the powers to be overtook it with what I just believe is liberal progressivism, and they have decided that their opinions, their political beliefs are what everybody should do. And it's coercion, it's abuse of authority. Again, I'll say this multiple times, we're not litigating the legality of abortion. We are
Right.
litigating trying to say you cannot be forced to do one, especially in authoritarian hierarchy that residency is.
As you, I'm a doctor, not a legislator. You're both. As after you introduce this, share with our audience what's the next step, because this should be a bipartisan support system if you want truly choice in
Yeah.
medical education. What's
Yeah,
next?
it should be bipartisan. I don't know that it will be, because given the extreme left now pulling so much of the Democratic Party so far to the left that they'd get in trouble for doing this. But nobody should be forced to do this. So this will have to go through committee. If the chairman, will bring it up. I don't know which committee to which it's been assigned yet. Chairman has to bring it up. It'll have to be debated, hopefully passed in committee. Then it would have to be passed on the House floor. And then it would go over to the Senate, or if Senator Lankford at the same time is able to push things through the Senate, we have to get, multiple Democratic votes over on the other side. But this is ridiculous. And I hope, if anything, if we don't have to do this legislatively, that ACGME would do this on their own, that they would say they would realize what they're doing is wrong, that they are pushing a political opinion rather than a medical opinion, and then retract it on its own. But if need be, then we pull funding from programs that are doing this, which is wrong. I don't want to do this. I want to support our residents. I want to support our medical education. But if they're going to put politics, their own personal politics, involved in the education of medical students and residents, then there will be consequences.
You've talked about a lot politics. So, as both the unique space that you hold as a doctor who is in Congress, share with our audience why it is so important that legislation like this that protects conscience rights is available to our generation and the next generation of students who are going to be doctors.
Yeah, we have to, I think when medical students and residents go into programs, they have to understand or feel that people in Congress care about what they feel about, that they are being represented, and it's not just being pushed upon by authoritarian system. I think that's important, that they understand that if they're being forced to do something against their conscience, this is not what America is about. This is not how America was discovered. It was supposed to be a place for religious liberty, and this is very much religious liberty for a lot of individuals. So we have to press upon Americans that we're still fighting for that ideal. And if we've come down now into medical education where it is at risk, that we are fighting to restore those ideals and that freedom.
Yeah, I could end the show right there, but we got a few more minutes. So let me just mention. So in our country, we have what's called the Coates-Snow Amendment, and this was a 1996 law that prohibits discrimination against healthcare entities and healthcare professionals like you and me based on our refusal to participate in abortions or abortion-related training. And when you think of ACGME, the Coates-Snow Amendment really opt-out is not consistent with the Coates-Snow Amendment. And while the ACGME added that based on moral and religious belief, you could still opt out and that sounded good enough.
Mm-hmm.
The reality is abortion is now very intentionally has been infiltrated into medical education, such that you have a resident who has a lecture that morning on why abortion is essential health care. And then that afternoon, you're supposed to cover these cases and be able to opt out. Reflect a little bit on, you have a student who has a strong faith, but they're green. We're very green when
Sure.
we start off, and we believe everything that hierarchy tells us, right?
Yeah.
And, I just think everyone has to really understand that it is not as black and white as just being able to opt out. It's
Yeah.
not simple like that.
Yeah. Susan, I'm absolutely sympathetic for young women that got pregnant, didn't want to, et cetera, et cetera, et cetera. Absolutely sympathetic with that. But on the other hand, you and I take an oath to preserve life. And again, I can't tell that person not to do it if it's legal. But what I can do is say that our educational system that forces people to perform these things are wrong. This is an authoritarian system, and it is wrong to push those beliefs upon medical students and residents. This is a young, tender age for medical students, and they're just learning how to be a doctor and all of the different other things that are going on. Good Lord, all the disease processes and everything, learning of surgical techniques, et cetera, et cetera. The last thing they need is to have their conscience tempered with and get told that this is the way that you believe, or they'll be punished because of it. That's just not what medicine has ever been about. And sadly enough, in the last several years, those progressive ideas are being pushed upon people, which is wrong. And this is one of the reasons I am pushing back. I actually still see patients. I still operate. It helps me maintain what I do, what I love to do, but also to be literally in the mix with everybody else. And it saddens me to know that ACGME or boards or whatever are pushing down political opinions on medical students. This is wrong. This is not the way medicine has ever been run or should ever be run. And these are one of the reasons that I'm standing up against this nonsense. It's wrong, and we should not be putting politics in medicine.
Well, Dr. Murphy, we appreciate a good bill that is addressing a very bad policy.
Yeah.
And on behalf of the 8,000 members of AAPLOG and AAPLOG Action, we thank you. AAPLOG Action fully endorses this bill, and we are grateful for members of Congress such as yourself that care about conscious protections. And when you think about the one thing we all have in common, we're all patients.
Yeah.
We all encounter the healthcare system. And I want somebody who is taking care of me, who is in line with his or her conscience as they're taking care of me, whether it has to do with childbirth or I just went through breast cancer treatment. I want someone who is actually working and it's aligned with his or her conscience. And that's really what this is about.
Great. Well, thank you for having me. I've enjoyed the conversation. Look forward to working more with you guys.
Thank you. Well, thank you to all of our listeners for joining us today. If you like this episode, be sure to give us a like and subscribe on YouTube, or if you're listening on a podcast app, give us a 5-star review. Continue to help us clarify the confusion in the midst of medicine these days. Any support, any donation into your giving, we sure appreciate it, both for our C3 and C4, AAPLOG and AAPLOG Action. We look forward to seeing you on our next episode.